What's up, Smashers? Good morning. It is Sunday morning over at CrossFit Brentwood, hanging out, doing a really great workout, having a ton of fun. Hey, I could just do this. Hey, check it out. CrossFit, dogs too. That would be good old Mike. I think he ran I think he did the Juggernaut today. He's laughing because if you guys look up the Juggernaut, it's a nightmare workout. Mike says he's gonna do it twice. So anyway, hey, we're gonna be talking about bicep tendinitis, and a lot of the stuff is missed with bicep tendinitis because if you look at the way the long head of the bicep comes, it comes up, makes this 90-degree turn, affects the shoulder mechanics, the shoulder being able to get overhead. But the other thing is anytime you lift your arm up like this, that long head of that bicep is doing a lot of this work. So the problem is it's gonna bind up that shoulder, it's gonna wind up dragging it forward. But now flip around, go to the other side, you get that tricep as well. You're gonna limit the range of motion because that long head of the tricep, flip around, attaches to the scapula in a roundabout sort of way. So it's gonna affect the scapula and it's gonna wind up tilting that scapula so you miss that overhead possession. So if you're having a hard time getting overhead, what's going on is that shoulder's being dragged forward and down. So if you look at the way the glenoid fossa is, and the head of the head of the femur, right, head of the humerus sits inside there, that humeral head, it's got to be able to approximate this way before you can rotate upwards and get that overhead position. If you're getting a pinch in here, right here, that super funky, painful spot, yeah, it's generally because of that long head of that bicep and that tricep binding up the shoulder, so the mechanics basically get all wound up and the shoulder doesn't function the way it's supposed to. You lose that roll, slide, glide, and all you do is ratchet across the joint. Next thing you know, you're calling an ortho for a bunch of shoulder replacement stuff that you probably didn't need. Most of the stuff that you have going on, joints that are aching and painful, you can probably fix without going and get cut open. Now listen, if you need to be cut open because there's a tear or something like that, disregard what I just said. I got a message from a couple of you guys who were like, hey, can you fix a tear? No, if a tear needs surgery, it's just the way it works. So we're gonna peel away, it gets glued down inside here and affects all the tissue in here, and then that short head, which attaches to that coracoid process, ends up dragging that scapula up and over. Remember what I said, scapula is the shoulder, shoulder is the scapula. So we need to unglue all that. So first thing is we're gonna take a barbell. Yeah, you can't see it right now because it's down here, but check this out. Oh, it's just that easy. Yeah, so you take a barbell, and I know you guys have seen this stuff before, but it's really important. And one of you guys talked to me about bicep tendinitis. This is how you clear this out. So you remember, tendinitis gets worse with use. Tendinosis gets better with use. So understand there's a fundamental difference there, and I'll go over that in another video and explain why. But you got some tendinitis, we're gonna peel away that tissue, and then you gotta knock down that inflammation. But the first thing you have to do is restore the function of that tissue. It's getting laminated down, and that long head of that bicep affects just about every movement the shoulder does. So this is my bum wing, so I'm gonna show you what to do. You're gonna take the barbell, okay? You're gonna take it just like this. I'll bring it up just this way. You're gonna bring your arm all the way out like this, grab the barbell. You're gonna set it basically in the notch right in here. There's two parts to this. So you're gonna set it in the notch, and all you're gonna do, so pronation and supination is what the bicep does, as well as flexion of the elbow, right? So you wanna pronate and supinate to really affect that tissue so you can restore those sliding surfaces and then let that shoulder do what it's supposed to do, because mobility is gonna be the basis of all the function that you're gonna do. So you will have no strength if you have no mobility, I promise you that. Talk to anybody that has no mobility and they got the shoulder range of motion like a T-Rex. Yeah, it sucks, right? T-Rex hates burpees. I hate burpees, and I'm no T-Rex. Velociraptor, maybe. Good. So all you're gonna do is you're gonna sit there and you're just gonna peel this away like this, all the way across, right? Now you can come up here, go even higher. So now I'm right on the deltoid anterior portion, right where that long head makes that 90-degree turn. And you're just gonna do the same thing, except you're gonna go back and forth like this. Now here's where it gets really funky. If it's not enough, drop your knee down on that and start peeling it away. You wanna restore that internal rotation. So there's two more things we're gonna do. We're gonna hit that internal rotation with a banded stretch, and then we're also going to peel away that long head of the tricep, see? So like I said, get it on the high part, so low part, pronation, supination, right in that notch, high part, back and forth, restore that internal rotation. And then we get a guy like Matt who wants to come over. You get a buddy, this is even better. So he's just gonna come and stand on me. So if you don't think the bar is enough, you're gonna have a buddy stand right here. So this is Matt, all you're gonna see is his feet.
How you doing?
He's gonna poke his head down and say hi because he's just that cool. That's my boy Matt.
Yeah.
So he's gonna stand right here Go ahead and put your foot right here.
Seriously?
Yeah, not hard, just a little bit.
Right.
So you see how he's got his, he can put his weight on there a little bit more. That's it. And then all you're gonna do is you're gonna, oh God, this is abysmal. Oh. That's the first time I ever hugged a man's leg because it hurts that bad. And you're just gonna do the same thing, back and forth. Go ahead, and then you can tap out on this one. But that's what you're gonna do. That'll help peel away that long head of the bicep if you don't have a barbell, or you got a good old boy like Matt to help you. By the way, Matt's a badass athlete. Don't think he's not. He's a savage. Makes me look bad. All right, so that's the long head of the bicep, number one. Number two, thanks, Matt. Number two is, come up here. You need to take this. You're gonna cinch it up just like this. We'll just move this all the way back. Yeah, so now we can see what we're gonna do is we're gonna grab this, wind up just like this, and then you're gonna take the bar or the band and you're gonna allow it to pull your arm all the way up behind you, but not against the rib cage. You're gonna let it pull you away. So you can see how the band is pulling me away. Now this is a bad position for the long head of the bicep. You wanna have that chest as upright as possible. This is gonna restore a lot of that internal rotation. I can feel it just searing it away in here. It feels awesome. You're gonna hang out here for how long? Yeah, 2 minutes. You got it, 2 minutes. Last one is the long head of the tricep. Bring that down just a little bit. Now this band is pretty used, so it's a little bit loose. But what we wanna do is we wanna peel away that tricep as well, because if you're only working on one side, of the joint, you're only gonna affect part of the joint. You wanna free up that entire joint. So all you're gonna do is you're gonna take this, same thing, wind up the same way. You're gonna come all the way across to this side of the rig, and you're gonna let it drag your arm all the way back, but keep that elbow in really, really tight. So this is what you're gonna do. And you're gonna hang out here for how long? Yeah, 2 minutes. So I'll show you on the other side, just so I can actually watch this. You're gonna wind it up, bring it all the way up. So you can see what I'm doing is I'm letting it bring the arm up and over. And then you're gonna take your arm and you're gonna shove it up against the rig. Try and bring the armpit all the way to the rig. And then hang out like this. 2 minutes. Unglue that long head of the tricep. I promise you this, you have bicep tendinitis. This is gonna provide a ton of relief, but the other thing it's gonna do is it's gonna give you a bunch of function back. You're gonna restore a lot of the mechanics of that shoulder, so your overhead position becomes normal in the way it's supposed to be. Hey listen, I'm Trev, SmashweRx, CrossFit Brentwood. I'll see you guys tomorrow. Have an awesome day.